I'm Rachel Foster with the Brazos Valley Area Agency on Aging, and I've been a Medicare beneficiary for now almost 2 years. I was trained by Stacy. She is now the boss, and so she has probably 12 years of experience with Medicare. But we're all both been trained by the state. We are not insurance agents. We are what they call SHIP, benefit counselors, and we're trained by the state, funded by nationally. So we are a requirement of the state of Texas to have, so that people who have Medicare can come to a neutral person and have their Medicare or options explained to them. Okay, I'm going to put it there. I do know a lot of things, but not everything. So if there's any questions that you guys do have, I have resources where I can go back and ask. Okay. Welcome to those who are joining. Looks like we have some people joining from Zoom, so I'm really excited. I do love to hear where everybody's at with Medicare, because with all these commercials and things that are going on, it is really confusing for people. And people actually use their Medicare in different pathways, I like to say. We're all not lumped in the same way how we get our Medicare. And so I kind of need to know a background where everybody's at. And I think we're small enough to say we can be able to do that, okay? Just make sure that I do not want anybody's Medicare number or anything like that, anything that is, you know, account-wise, I don't want that information in this kind of setting. So who would like to go first in saying where their name, and assume, tell me your town. We're not going to want to assume that everybody's from Centerville or anything like that. And then where you're at with your Medicare.
Go first. Oh, I'm Susan Roush, and I live in Buffalo, which is right down the road. So, and what did you want about Medicare?
So you have your husband and you're on both Medicare?
Yeah.
And how long have you been on Medicare?
Let's see, I've been on mine for 6 years, and he's been on his for, oh God, he's gonna be 77. He's been on his for probably 10 years, I guess, if not,
okay.
Well, maybe 8 years. He didn't retire right away, so I think about 8 years.
Okay.
So, and I was always confused because I thought Medicare was our primary coverage and United Healthcare was our backup. And I used to argue with them, no, Medicare, but they say, no, United Healthcare. So I didn't understand how that worked.
It gets a little bit more confusing when you're talking about retiree packages too as well.
Okay.
Okay.
Yeah, because no one explained anything to me when I retired, and I did all my retirement stuff online via the computer. I never talked to anybody. So yeah.
Okay. All right. Thank you. All right. Next to you.
I'm Melinda Wilson. Okay. My husband's been on Medicare for 8 years now. He's retired, and he retired from being a teacher, so he has teacher's retirement.
TRS,
that's where I get my insurance is currently with Aetna, but in February I'll turn 65 and I have to get on Medicare. So that's what I'm kind of wanting to learn. What do I need to do to get all that taken care of?
Okay, so you're on the TRS. I should have brought my TRS cheat sheet, because you're going to be paying a lot to be on TRS. So, but I don't know what the new stuff is, so I'm a little bit outdated. But okay,
yeah, because they're switching.
Do the best we can on that. Okay. All right, and then we have somebody on Zoom, Donna?
Yes. My name, can you hear me?
I can, Donna.
Can you hear me? Okay, I'm sorry. My name is Donna Botchok, and I live in Marquay, Texas, and I'm not currently on Medicaid or Medicare, but I will be in July of next year. So I just wanted to learn some information about it.
So we got a newbie. All right.
You're welcome.
That's well said.
And Donna, just to let you know, I'm going to mute you just so we don't have that feedback. But if you have a question or something, just unmute yourself. Or if you have a question, you can text, chat, or do anything like that. Just holler at us, okay?
Yes, ma'am.
Thank you.
Okay, so I guess what we're going to briefly do, because we do have some people who have been on Medicare for a while, and then we've had Donna who's new to it. But I kind of want to do a kind of an overview, because a lot of times I meet people who have been on Medicare forever and they're still confused of what everything is, okay? So Laura, do you mind putting up that handout? And is Dawn, I think Donna's going to be able to see that. Maybe not. Laura, can you hear me? Oh, thank you.
Well, I was trying to be efficient and mute us, so I have to unmute for you to hear us. So I apologize, but yes, I've got it up. So if I don't respond, it means I'm having a blonde moment, and I've muted us.
Thank you. Can everybody else in the room see that? See the handout? Or did you make copies? Okay, I see head noddings. Perfect. Okay. So briefly what Medicare is, and everybody pretty much knows this, it's just a health insurance, okay? And you have to be 65 and older to get it, unless you have been getting Social Security disability. And if you're on Social Security disability, once you've been on it for 2 years, an exact payment of 24 months, then they move you to Medicare. And also people who have kidney failure automatically get put onto Medicare. So those are the scenarios of people having Medicare. So I do talk to clients who are maybe 40 years old that have Medicare because of their disability. But for the most part, the larger group of people with Medicare are 65 and older. So we have parts of Medicare that they label them with the alphabet, okay? So Part A is the health insurance. Now this is the one that's tied to our work history and that is free to us if we have a work history or are married to a spouse with a work history. So you can claim your Medicare stuff or your Medicare work history based on marriage as well. So this is just the hospital, anything related to a hospital, home health, skilled, anything that takes 24-hour care pretty much is what Part A it covers, all right? So like I said, that is the monthly premiums are free, but there are deductibles tied to Part A. The deductible for Part A, weirdly enough, is based on what we call benefit period. And that's really weird because it's not based on a year. And in 2020, that deductible was $1,408 each benefit period, which is the time when you're in the hospital for 60 days. So we'll not necessarily go into that because that's really boring. But just to let you know, the A is free monthly, but there is still costs related to it with the deductible. Also, Medicare is an insurance that pays 80-20 after you pay your deductible, right? So once you meet your deductible, Medicare pays 80% and then we're left with the 20%. So this is where the different pathways come in to help us figure out how do we cover that 20%. The next letter in the alphabet is B, and B for Medicare is the medical part. It's the doctor's office, medical supplies, things like that. And there is an annual deductible. It'll probably go up again in 2021, which I haven't seen the official release numbers for that. But this is the part that's not free. Right now, currently, we pay $144.60 out of our Social Security, or we pay it however we have set up for payment. So this is not the free part. So we are paying a monthly premium. And we'll talk about, and if I forget, remind me, we're going to talk about the ridiculous commercials saying how they get that $144.60 reimbursed. There is an income limit to that special program. Okay, and we'll talk about that in a little bit. But Part B, again, is the medical, it's the doctors, it's the medical equipment, and that is what we pay for, okay? Now, I am going to skip the letter C, okay? And we're gonna come back to the letter C. But prescription drug coverage is your drugs, okay? That is the thing that they tacked on a few years ago, which was great, adding Medicare. So Medicare Part D is your drug coverage, and it is ran by private insurances, okay, that work with Medicare. In our area, there are 35 different Part D plans with private insurances. So that's what this open enrollment is. One of the things that it's about is changing our Part D prescription drug coverage, if that's the path we're on. Okay, we're gonna roll down a little bit more. and talk about the different pathways, okay? So, and this is where we're going to enter into what C is. So most of the time we have original A and B, okay? And then we can get our prescription drug coverage. And if we have a retiree plan, that helps us to cover, let me start over. So we have A and B in our prescription drug coverage. But like I said, Medicare does not pay 100% of everything. It's that 80-20. So the problem with Medicare is that 20% can financially ruin us, right? We can go to the hospital, pay the deductible, and pay 20%. And then we go to the doctor's office and pay 20% after our Part B deductible. So that 20% in a year's time can add up and financially ruin most everybody, okay? So we really do need what's called a Medigap or a supplement or something to help us cover what Medicare doesn't cover. So here comes in the retiree is one pathway. The Medigap policies is another way, which is sometimes called Medicare supplements, or the Medicare Advantage plans, which is known as Part C. And sometimes people call those as supplements too as well. So that's why you're going to hear me say Medigap or Medicare Advantage plans, and I will not be using the word supplement because it's too vague and very confusing, okay? So those are the two pathways. I like to have the retiree package kind of being a third package, but regardless of what path you are on, whether you're on the retiree with original Medicare, Medicare with a Medigap policy, or Medicare with an Advantage plan, unless you are in the low income bracket, every one of those pathways has their Part B having to pay that $144.60, okay? And I think that is going up, by the way. I think I've gotten some publications saying it may be $148.50, but I haven't seen the official announcement of that yet, but just a heads up on that. So what I want to talk about first, and I think that's what the most confusing things right now, is these Medicare Advantage plans. To make things even more confusing, we have somebody on TRS, which has their plan be a retiree plan with a Medicare Advantage plan with Aetna. So there are different types of Medicare Advantage plans, standalone policies, or retiree packages, okay? But, so Medicare Advantage plans, what they are is taking your A and your B and your prescription drug coverage and smashing it into underneath an insurance company so that you are committing to an insurance company and you're telling Medicare, you're taking everything about your Medicare and committing it to one insurance company to manage for you or help you manage. So a Medicare Advantage plan, which is also known as your Part C, takes your A, your B, and your prescription drug coverage and adds what we call enticements to them, okay? Now these commercials that you're seeing, these enticements, those commercials are very deceiving because they're national commercials, right? And so there are different types of enticements depending on where you live in the country. So what's in California, what's in Florida, what's in New York is not necessarily in the heart of Texas or what's necessarily available in Leon County, okay? So those commercials to me are very, very frustrating because they can say everybody gets home delivered meals and everybody gets dental coverage and vision. And it's kind of deceitful because that's not the case. It is really based on the region. Okay, so in Leon County, there are 3 companies that do self-standalone Medicare Advantage plans: United Healthcare, Allwell, and Humana. It used to be Scott and White. Scott and White was available last year, and I've had lots of clients from Leon County that have called and said Scott and White's dropping this. Yes, Scott and White is no longer allowing to sell their Medicare Advantage plans in Leon County, regardless if somebody's coming all the way to Bryan College Station to see a Scott and White clinic, okay? So Medicare coverage, whether it's prescription drug coverage or your Medicare Advantage plan Part C, are all based on where your house is at, not your P.O. box, not where you're vacation at. It's based on where your house resides. And so it is then you are limited to what Medicare programs to participate in based on that zip code of where your house is at. So with Leon County, it is now limited to 3 companies selling Medicare Advantage plans. So the first thing that I always tell anybody who's seen those commercials and thinking that they want to join those, because it's a private owned insurance company going to be managing your Medicare, you need to find out whether or not your doctors take those plans before you sign up for it. So a doctor can take Medicare, but they don't have to take Medicare Advantage plans. So you have to make sure that the doctors that you're going with will actually accept a Medicare Advantage plan before signing up. So here comes this new plan. Scott and White left Leon County. We've got a new one come in, this Allwell, which must be coming out of the Dallas area. I've never seen it before. Has really great coverage, and somebody wants to join that in Leon County, that's fine, but I'm going to tell them, if you see doctors in Bryan College Station, they don't take it. No one in Bryan College Station will take this plan because it's not in our area. In the Bryan College Station area, it's only in Leon County. So that was always the first question that I asked people if they're interested in switching to Medicare Advantage plans, what their doctor takes, what they accept. Okay, so before I go on, I want to see if anybody's interested even more to hear what I have to say about Medicare Advantage plans. If you want me to continue going more in depth of that, or if you're not interested at all, then I'll just stop there.
Thank you.
Does
I'm
Scott
interested in it.
healthcare? I'm sorry.
Go ahead, Donna.
Say, well, I'm interested in hearing more about it.
Okay. So a Medicare Advantage plans, like I said, has your hospital, your medical, your prescription drug coverage, and extra things thrown into it. Okay. Now these commercials are talking about dental and vision, and all those things are covered. But what they're not saying is, yes, they're covered, but the amount what is being covered is pretty pathetic, to be honest. Mm-hmm. They're very limited to the things that they cover. So, and then you can add, like United Healthcare has a plan where you can pay to add more additional coverage to it. But even those coverages are not very much. So like United Healthcare has now, you can, I think their basic plan is only $500. So we'll cover dental and up to only $500 of a dental procedure, which is not much. Humana has a package which you can add to, and I think there may be 2,000 that you can add. So as you know that so cleanings and x-rays are generally free and paid for with your premiums, but fillings and any comprehensive dental procedure is either paid at 50% or covered not at all. And so you have to use that 2,000 or whatever that limit is based on what plan you pick. So if you ever gotten dental procedures before, comprehensive root canals and things like that, you're still paying a lot of money out of your own pocket to have, even if you have dental insurance, okay? And so these Medicare Advantage plans saying they have dental, it's not a lie. They have a dental coverage, but it's very little coverage, okay? And sometimes the standalone dental coverage, you may pay a little bit more, but you'll also be able to get more benefit out of it. So you have to figure out what your monthly budget. All these pathways is really going to be based on whether you have a retiree package, whether you have to get your standalone Medicare options, and what your monthly budget is for these things, and what your health conditions are to determine what pathways you should be on. Because, like I said, everybody's at a different position. So there's not a clear-cut case where somebody should be at, because it needs to be based on their budget. There is a little bit of vision, and a lot of times that vision is only covering eye visits, a couple of eye tests, and maybe if we're lucky, $125 to cover frames. So they don't cover lenses and things like that for most part. And so again, vision coverage is really not a true statement in the sense that it really even covers glasses and stuff like that. So you really have to look in the details of each of these plans to determine, do I want to leave my retiree insurance, or do I want to leave my Medigap pathway to join these things just because they say they have dental or they have vision, okay? They also do have a little extra enticements. United Healthcare sometimes has plans where they'll throw in $25 or $30 to go to CVS. Sometimes they do cover home delivered meals when you come home from the hospital. But those home delivered meals are actually provided by me sometimes. And so it doesn't matter if you have insurance or not, we work with each county to provide home delivered meals for homebound clients. So that's what I get frustrated about. So I'm trying to think so these extra benefits, you really need to look down and figure out and compare them. What am I actually paying for? Okay, so that's the Medicare Advantage plans, the commercials you're seeing. Those commercials, when they talk about that $144.60 being credited back to you, it's based on income and assets on a household. So there are national programs and state programs to help people cover their Medicare expenses based on their income. So when they say that Part B being given back to you, in the state of Texas, a single person not married, okay, has to have a monthly income of less than $1,456. And this is their, before they take any deductions out, because this is what Social Security and any income before any deductions, taxes, Medicare taken out. So it's $1,456. Okay, for a couple, that's monthly income. For a couple, it's $1,960 for the couple. And then as a single person, there's also an asset. You can't have more than $7,860 in assets. It's not counting your house, and it's not counting your one vehicle. But if you have property somewhere else, or if you have a retirement plan, or a 401k or things like that. So you have very limited savings, okay? As a couple, you can't have more than $11,800. There's also another program, and that income support or help is called a Medicare Savings Program. So that's what he's talking about when he said, oh, you can get that $144.60 given back to you, is a Medicare Savings Program that they use Medicaid money to help cover, okay? The Part D prescription drug coverage also has a low income program ran by the Social Security office on a national level, and that income limit is $1,615 as an individual and $2,175 as a married couple. And the assets are $14,800 for an individual and $29,160 of resources as a couple. So I know I briefly went over that really quick, but if that's something that you feel like you fit into as you and your husband, or you as an individual, or you have friends or family that fit in that low income category, have them call me and we'll go through the steps of how to get Health and Human Services and Social Security office to apply for those things and get those benefits. So that's what that commercial is talking about. And it's kind of frustrating how they say that, but it's a low income benefit. Any questions so far? It's kind of weird when I can't see people. I can't hear people. And so I don't know if there's any questions. So I start talking and I don't want to lose people. So is there any questions?
I think Melinda has a question here, so I'm going to let her do that.
Okay.
Does Scott and White take United Healthcare?
Yes, they do. Now, the frustrating thing about doctor's offices and big organizations like Scott and White, okay? When I always tell my client, to confirm with their doctor whether or not they take an insurance company, a plan, right? And I've had people call their Scott and White doctors, and that doctor says, no, we don't take United Healthcare. But then when I turn around and talk to the Scott and White system itself, they say yes, okay? So that puts me in a rock and a hard spot, right? Because an individual doctor, even if they're contracted with the Scott and White, for the most part, I think they should take United Healthcare. But a doctor, depending on how they're contracted with a big organization like Scott and White, or they're a private and they just go to, or they can just use the Scott and White hospital. So how somebody is tied individually to a big chain like Scott and White is kind of confusing. So, but an individual doctor can decide to drop United Healthcare almost anytime they want to.
Mm-hmm.
So United Healthcare can say they take it, that Scott and White takes their plan, but an individual doctor say, I'm no longer not taking United Healthcare because they're too slow in billing. So a doctor can stop taking insurance. Now they need to notify you if you are a current patient. But yes, I was told 3 times by major Scott and White billing people that they take United Healthcare. But individual doctors have told me that they don't. So there you go. I'm sorry, it's very confusing, but I would just make sure when you get there, before you get to your appointment, and some of them take United Healthcare PPO, but not the HMO. Does everybody understand the difference between PPO and HMO?
PPO is your primary care.
Right.
Yeah.
So in HMO, you have to go to your primary care physician first, your family physician or your primary care doctor, and get a referral before you can go to a specialist. Okay. So an insurance has to approve a referral from your primary care physician before you get to a specialist. Okay. That's an HMO. So it's being managed by your main doctor. Okay. And then he can send you off to specialists. But you can't see that specialist until the insurance has acknowledged that referral and has said, yes, we will pay for that. So that's a referral process. A PPO, but you still have to use that insurance network of doctors, right? All right, so a PPO, you can go straight to a specialist without a referral from your primary care physician, but you still have to be specialists that will take your insurance.
Right.
So they still need to be in the network. Now, some of these plans do have out-of-network coverage, but that coverage rate is not, some of them may be the same or maybe 50% or maybe only 20%. So you have to look at your different policies. So that's the difference between an HMO and PPO. And generally a PPO costs a little bit more than an HMO because you're paying for that freedom to go see a specialist, okay? So those are some really good terms to recognize when you're looking at policies. That's what I wish I had the TRS cheat sheet that I had. I can't remember if Aetna with Medicare is a PPO or an HMO. I think it's an HMO.
I think so.
Remember?
I think it's the HMO.
I think it's an HMO, yeah. Whereas as the gold plan for United Healthcare is a regional PPO, you can go straight to a physician without a specialist without getting approval from your primary care physician. So you have that freedom to do that.
Yeah, we have PPO, but then mine also has regional PPO C-SNP.
I don't know.
I don't know what that is. It's right after the PPO, whereas my husband just has regional PPO.
Yeah. Oh, you see, what does it say on the end
Mine
of yours?
is regional PPO C-SPN.
Okay, that stands for Chronic Special Needs Plan.
Okay.
That's what that stands for.
Okay.
That's what kills you too, is all the acronyms
I
and
know.
the abbreviations. And all.
We have the same
all-
out-of-pocket expense. Well, no, I don't. My
Running out of time.
PCP is $5, so.
Yeah, so let's talk about some features when we're looking at these plans. What are the things we should look at? Because it's so very confusing. By the way, all this information can be found on Medicare.gov. So if you guys like going on the computer and looking at stuff, you have to be really careful. You just gonna put Medicare Advantage plans, because you're gonna get 10 different ads of different companies. And as soon as you click on there, and I've had people say, well, I thought I was on Medicare website, it said Medicare, I put my phone number. Well, whoa, Medicare is never gonna ask you for your phone number until you are actually enrolling to a plan to verify who you are. So as these people have told me, they put their phone number, within literally 2 seconds, they will getting phone calls. You're getting phone calls already, but now you're really gonna be getting phone calls, okay? So make sure if you're looking up any information about Medicare, that it is really medicare.gov. And it will say official Medicare, website. It is as simple as www.medicare.gov, okay? That's all you need to go when you're looking for information for Medicare.
Okay.
So the information I'm getting based on to find out what plans is in Leon County is really going to the Medicare site, putting in the zip code of whatever city I'm looking for, Leon County. Oh, perfect. Oh, you're wonderful, Laura. So see, it says the official U.S. government website, okay? So you click on there and you put your information in, and it'll help you find the plans that you're in, okay? And I help many people who are on the computer at the other end of the phone, and we will walk you through it. Or if you want to come and see me face to face, that's what we're going to be pulling up, is the Medicare site, okay? So that is really the best place to go to get any Medicare information. You can find out where things are what's covered by Medicare and what's not covered by Medicare, what Medicare Advantage plans are offered. The only thing they do not do good on, and they cannot do good, is the Medigap, okay? And so make sure I go back and talk about the Medigap, because especially with Donna being new, she has that option of getting a Medigap policy, okay? So Medigap plans are generically listed in Medicare, but because it's ran by the Texas Department of Insurance, and each state's Department of Insurance is regulated by the Texas Department of Insurance, Medicare has nothing to do with that. There is not, and it's an insurance policy versus a health policy. There's some differentness in it that they cannot put those detailed information on the website. Does that make sense for everybody? Yeah, kind of, sort of, and not. But anyways, so when we're looking at our Medicare Advantage plans, we can go and click on health and drug plans. You click on that, put the zip code in, and it will give you the detailed information about the plans available to Leon County. Now, oftentimes what I do then is, once I find what, like I said, Humana, the difference between these three plans that are Medicare Advantage plans that are not the special needs plans, these are just the regular everyone qualify for plans, there's some varying different things about it. But when we're looking at plans, oh, perfect. If you can click on the Medicare Advantage plan. The people in the room, can you guys see that? Do you guys have an off screen in front of
It's
you?
huge.
Yeah, we got it on TV
Okay,
here.
good. Well, my presentation is looking great. Thank you, Laura. So then you put your zip code in there.
Leon?
Let's go down a little bit further. Okay, so these are the Medicare savings programs that I was talking about. You see that that's what these things are, okay? Extra help with Social Security. So right now we're just gonna go, I don't get help from these programs, okay? And we're gonna put no. If you are curious to see if you are having, if you do take medications, you can put your medications in by putting yes. And each of the plans, whether it's a Medicare Advantage plan or a regular prescription drug coverage plan, it will give you the cost of your medications on those individual plans. But for right now, we're gonna push no, okay? And then hit next. Okay, so there are 10 plans, but only 3 companies. Well, I take that back. There's actually 4 company, but that one I don't ever recommend to anybody because it doesn't have drug coverage. So, as you can see, there's Humana, the Allwell, and United Healthcare. Again, Allwell is fine. It actually has great coverage, but you have to have doctors not in Bryan College Station. You have to be going to Athens, Palestine, going north to have that covered. That Lasso company, that is ridiculous. No one needs to ever be on that, and it doesn't have drug coverage, okay? So United Healthcare has a plan, and then Humana. So when you're looking at these plans, stop right there. You see that it has a monthly premium, and then it has a drug cost, okay? And then also you go other costs, health deductibles, drug deductibles. So let me talk about each of those things right now, okay? So some of these plans have a health deductible. So I think most people understand what a health deductible is, but just in case. So a deductible is something that you have to pay first before an insurance company will then start to cover stuff, okay? United Healthcare, you see their health deductible, which is covering expenses for A and B of your Medicare, $0, no health deductible. But if you look at Humana, some of those plans has a deductible, $750 deductible, which means as I go to the hospital or to the doctor, I have to pay $750 of my own money first before Humana will cover anything. And many of my clients who are on Social Security, that means they'll never go to the doctor because they don't have $750 or may not have $750 to pay towards to pay first before they actually have Humana cover it. So you have to really look at your budget. But then some people may actually have a lot of money in savings and they like Humana. They've had Humana in the past, and the $750 deductible for them may not be a big deal, okay? But many of my clients, a $750 deductible is a big deal, okay? So as you can see, as when we're comparing these things, you need to look to see whether or not they have a deductible. What is, if they're a PPO or an HMO? What's their monthly premium, okay? You notice that, so it has their monthly premium. It says does not include the 148. So apparently Medicare is now announcing that the Part B premium is going to be $148.50. So it's gone up $3.90 or whatever the math is, okay? So, so that is kind of a jump. So all these plans, you have to pay that plus the premium. But you saw previously that Humana has no monthly premium, but it has that $750 deductible, okay? Okay, so those are the things to look at is their monthly premium, whether or not they have a deductible. I do look at the drug deductibles. What's interesting about the drug deductibles, if you are on generic or tier 1 or tier 2 simple medications, you don't actually pay for the deductible. The drug deductibles are usually for medications that are tier 3 or specialty medications. So not all your drugs actually go towards paying your deductible. I've had many people who have a $450 deductible, but they never have to pay that because their medications are maybe a thyroid and metformin, and they cost only a few bucks or not anything at all. So they don't have to worry. So the drug deductibles, you do need to pay attention to, but that's not what, it really is based on whether or not you have drugs that will actually have to be paid, that deductible will be paid first before you get coverage, but that is an individual thing. And so it's something I look at. The other thing is, what's this in?
I have a question.
Yes.
Okay, so I was currently put on Humira. Humira would be one of those specialty drugs.
What was her question? She had switched to Humira or something like that.
Oh, Humira, yes,
About
right.
her medicine that she's starting to take. Yeah, she was talking about that.
So The Humira, because it does not have a generic and it's a specialty medication, that would go towards her deductible. So she would have to pay the, oh, she's getting
She's
on.
getting back on,
Wait.
so
Yeah, she's getting back on.
yeah, it's gonna take her a moment.
I
to
wonder I
connect.
remembered.
Hi, Donna. I'm so sorry. She don't have her-
Hi, Donna, can you hear us?
She doesn't seem to have a mic at the moment.
Oh, it's connecting,
Connecting,
hopefully.
connecting.
Connecting.
There she is.
I'm back. I'm so sorry. I lost you for a minute.
Oh, girl, it was our
No, we
fault, so
lost
I'm
you.
so sorry. It wasn't you at all. But
Oh,
I think Rachel's trying to answer your question, so we'll just continue from there.
okay.
So it's a question of Humira, right?
Yes,
So-
ma'am.
Because that's a brand named, relatively new medication, it does not have a generic, it's expensive.
Yes.
That would be something that would go towards a drug deductible, okay?
Okay.
So you would have to pay the deductible first, and then they would pay a percentage of it. It doesn't mean they're gonna pay for all, so it depends on the plan that you're on. It may be a tier 4, it may be a specialist, it may be a tier 3. Each of the different plans are very varied on where they would put those specialty drugs in, and that will
Okay.
tell you the price of what that is. So somebody, once you paid your deductible, then it may cost you $179 or something like that. But then there's also, we're going to talk about getting into the donut hole in a little bit, because you would get into what's called a donut hole, okay?
Okay. Okay.
So, but we're going to go back and talk about the things that we're looking at when we're looking at plans, the details. So we looked at monthly premiums, their, whether or not they have a deductible, okay, for the drug or the medical, okay, or what they call that health sometimes. And then the other thing that I like to look at is what's called whether or not it has in or out of network benefits. But those in and out of network, what those numbers are is what's called their maximum out of pocket cost, okay? Or the max in the health, Medicare, they call it maximum you have to pay for health service. It's called the maximum out of pocket cost. Means when you reach to that level, then that insurance will pay 100% of your benefits, okay? So again, that varies from United Healthcare. It may depend on what plan you are. See, I'm perfect. So on that United Healthcare regional PPO, you'll see that the maximum out of pocket cost, that in and out of network, is $7,555.
Mhm.
So that's talking about co-pays, deductibles. These are all medical, not drugs, okay? So you go to the hospital, maybe you're in there several days, okay? And maybe you're having several trips, but you know that that's what you call the worst case scenario. If you've reached out of your own pocket $7,550, then United Healthcare is going to pay 100% of everything that's Medicare approved. You still can't go get plastic surgery and expect that Medicare will pay for that, or United Healthcare will pay for that. But so that's why it's really beneficial, because for people to be on a Medicare Advantage plan than being on nothing. So many people said, I couldn't afford a Medigap, which they're sometimes expensive for people's budget, and they didn't know about Medicare Advantage plans, so they're paying the 20% all and the deductibles themselves out of their own pockets. And for me, I would prefer somebody to be on a Medicare Advantage plan than not be on anything at all. Because if somebody goes into the hospital, those 20% can add up to beyond, $20,000, $80,000, right? But on a Medicare Advantage plan, you know that you have a worst case scenario option. You have a limit in which will have to be spent out of your own money. So it's kind of a worst case scenario. So each of those things are very different depending on what plan you're on. So that's one thing to look at, is what's maximum out of pocket costs. And then I also like to look at obviously what the co-pays for primary and special doctors, but what are the co-pays for hospital stay? So if you will click on plan details, I can kind of show you how to read those, okay?
Details. Where am I at?
If you scroll down a little bit further,
Oh, okay, I'm sorry.
Introduction plan,
There it is.
plan detail.
plan detail. Okay.
Okay, so you can scroll down and you see there's a total, your monthly premium for this plan is $49. That $49 is broken down to $10.20 to cover drug part, and that $38.80 is to cover medical parts, okay? There's your Part B premium now, that new cost. You see that it has no health deductible. That's what we're talking about, the drug deductible. So something like Humira would have to, you would have to pay that $395 first before United Healthcare will cover that. This estimated yearly cost, ignore that. That's just, I don't even know where they get that money. They're just saying, oh, in this kind of ambiguous scenario, this is your estimated cost. Okay, it doesn't make any logical sense. So I don't even know why it's there. Okay, so there's your maximum out-of-pocket costs, what they call it, maximum you have to pay for health services, okay? That's what that is. So you can see if you keep going, there's your primary care cost. So go to primary care in the network, costs you $10. But if you're somewhere and you need to see a primary care physician that don't take United Healthcare, you know that you can pay $20 to see a doctor outside of United Healthcare. Okay? Specialty visits, you see that.
Okay, I see it. Yep.
Okay. So then you see your tests and stuff. If you keep scrolling,
It's new.
yeah, keep going. You see there's your urgent care, you got emergency room and your urgent care. So if you go to emergency room, it's $90. If you go to an urgent care, that's $30 to $40, okay? Now next is your in-hospital out of coverage. These are the two things I like to look at. So if I know I have to get a knee replacement, okay? And I'm gonna be in the hospital for 2 days. You know that my cost, as long as I'm going to a hospital that takes United Healthcare, then it's gonna cost me $390 for day 1 and day 2. All right? So other plans may be $575 per stay is how they label that. Sometimes it varies. One other thing is why I say it's better to have a Medicare Advantage plan versus not, and having just original Medicare A and B, and you pay the 20% your own. If you were in the hospital for 2 days for a knee replacement without a Medicare Advantage plan or a Medigap, you would have to pay that Part A deductible, which is $1,400 and something dollars, okay? Plus 20% from day 1 and day 2. So that you're talking about thousands of dollars, right? At this point. So that's why having a Medicare Advantage plan is better than having nothing at all, because I know that I'm going to be paying $390 times 2 for my knee replacement. Does
I
that
have a
make sense?
question.
Yes.
Are you saying yes to me?
Yes. Yes.
Okay. So maybe I'm speaking out of turn or whatever, but I have to be watched for cancer, and I'll have to get a CAT scan every 6 months. Are those covered?
So if she scrolls back up a little bit, you'll see that CAT scan's listed.
Oh, okay. Oh, I lost it there.
Okay, so
I got you
diagnostic.
back.
Okay, so diagnostic radiology services like MRI and CAT scans, you can see that it's going to cost between $0 or $150. I'm going to assume the CAT scan's probably about $150.
Okay. Okay. Thank
But
you.
one of the things I definitely would talk to their insurance company before you commit to them saying, this is my scenario, what is that going to cost? Because in a
Okay.
sense, preventable, right? Because you're trying to
Yes, we're
not
trying to catch it earlier. Yes.
screens, right? Yeah. So that's really probably based on their coverage. I mean, their coding too as well. But so this is kind of showing you how to read a kind of a plan comparison. So somebody who has TRS, Aetna, Medicare Advantage plans, you can kind of see that I believe they have a deductible, and you can kind of see the things that you want to look at to see, is it better for me to stay on TRS, or should I leave TRS for these other self-standing policies? I have had people leave TRS and I've had people stay on TRS. It really just depends on whether you are the person on TRS or if the spouse added to TRS, because then the monthly premium is ridiculous. And then you have deductibles and things like that. So you can kind of see, do I want to go or do I want to stay? And again, based on your monthly budget and scenarios and stuff. But this is how you can kind of read. And so somebody who has a retiree Medicare Advantage plan outside TRS and wants to know whether or not this matches up, this is how you do that, okay? So if you scroll down, Lord, do you mind scrolling down a little bit more? I want to show you where their extra benefits are. This is where I get a little bit frustrated with Medicare.gov, because they don't do a very good job in giving the details of what these extra enticements are. So if you keep going, and you'll go, I think it's called extra benefits. You'll see it.
Yeah.
Yeah, keep going. Extra benefits. Okay.
Yeah.
So what's really frustrating, stop right there, is that there's not a lot of details on these things, okay? So a lot of times what I like to go is, I know that my option is Humana, Allwell, United Healthcare. So I will go to after I've looked at this, I will go to Medicare, the United Healthcare page and look to see what the details are, these extra benefits are. Because they don't list them very well. If you keep scrolling down, they'll say the glasses and the glass frames are $0. Well, I know that that's not true, okay? That they're not, that doesn't, so it says here, it says contacts and frames, okay? Glasses, frames, and lenses in network, $0 copay. It's not. It's not a $0 copay. You are paying something, okay? So that makes it look like you're getting glasses for free. No, you're not. This is a mistake. And that's where limits apply comes in and stuff like that. I really don't like that they put that. So a lot of times I do recommend people going, once they selected a plan, if they want the plan details, they really need to then go directly to that company and get these extra benefits. Rarely do I think you should pick a plan based on these extra benefits, because they all pretty much have them. It's really the bigger bill cost that you're going to be needing looking at, the deductibles, the monthly premiums, what the hospital stay is. Then look at these things after you find out your doctor takes it, okay? Like I said, because they're not doing a very good job explaining what your cost will be. So you can see that if you went down, that there's no comprehensive dental at all, okay? So that's, any other questions about Medicare Advantage plans before I kind of go? I want to briefly talk about Medicare Medigap policies.
No.
So I think I'm going to draw a little picture, because I'm a picture person, right? And I probably should have done this before. But, so we've got our, I'm going to call them the Medicare Advantage plans. That's one path. Medigap is one other path, okay? And then there is retiree, okay? Everybody see that?
Yes.
Okay, so your Medicare Advantage plans, we kind of already covered that. And a lot of us don't have a choice, in the sense if our retiree insurance is as your Medicare Advantage plan, we do have a choice where we can we decide to leave that retiree package, okay? But a lot of times if we have a retiree insurance and it's a Medicare Advantage plan, our choice is to either keep it or not and go to Medicare Advantage plan. Okay, Medigap. If we're turning 65, this is the best time to get a Medigap, okay? That Medigaps are, like I said, are insurance policies that cover the 20% and sometimes the Part A deductibles, not your Part B anymore, but cover your Part A deductibles and your 20% of both A and B, okay? They will cover that. And to make things even confusing, they have 8 standardized policy plans that are labeled A through N, okay? And they skip some letters in there to make things confusing. But to get the Cadillac of the Plan G that's the best one. And those generally cost $90 to $120 for somebody who's 65 years old to get the Cadillac of all the plans, okay? And that means that any Medicare expense, they will cover in full. After Medicare will cover their 80%, the Medigap will then cover 20%, that 20% in full, okay? After the Part B deductible, okay? So a lot of people like the Medigap plan because it allows you to go anywhere in the United States, even have some foreign travel, anywhere, any doctor that takes Medicare. So you have the freedom to go anywhere. You're not tied to an insurance network, all right? But to have that freedom, you're paying $90 to $120, okay? A lot of people, when they turn 65 and can afford that monthly premium, like the Medigap route or pathway. But what generally happens is as we age, that policy will age with us. So I have many clients who have, at age 85, can no longer afford their Plan G or their Plan F because it's now $350. So this is the time where I say, well, your option is to pay that 20% all on your own or get on a Medicare Advantage plan, which will help cover your cost. Now, a retiree side pathway is really based on whether or not you're lucky to have a retiree package as you retire. A lot of times these are good plans. There's too many in the state of Texas for me to know what they are. But the pretty common ones are TRS or Texas A&M has Blue Cross Blue Shield as a secondary insurance or retiree insurance, okay? And those plans comparisons are hard to do sometimes because it's really an individual thing. But knowing that you can leave a retiree insurance to get on a Medigap or a Medicare Advantage plan, okay? But you have to look at your retiree package to see if it's anything. Like I did somebody the other day who worked for the city of Bryan. Their monthly premium was $785 a month for their retiree insurance, plus their Part B Medicare, $144.60 for both the spouse and the husband. It could save him about $500 a month by switching him to a Medigap or even more to a Medicare Advantage plan. So not all retiree insurances are good to stay on, but then some of them are best. If somebody retired from Texas A&M, they have TRS retirement, but not health and benefits from TRS. They have their own individual retiree Blue Cross Blue Shield secondary insurance, and that's great coverage. So most people stay on that coverage, okay? So those are kind of the 3 pathways for people to choose to look at. And you can actually, now, retiree package is the only thing that once you leave it, you can't come back. But if somebody says they want to get on a Medicare Advantage plan, they can switch to a different Medicare Advantage plan. Or if you get on a Medigap, you can go to a Medicare Advantage plan years later. It's hard to get back on a Medigap policy because your premium is going to be based on your age plus your health. If you get a Medigap at older than the age of 65 and you weren't on group insurance, then there's medical underwriting. Your premium is going to be based on your age plus your health, okay? So most people, you know, especially if you've been diagnosed with diabetes or cancer, whatever, a Medigap policy plan will deny you and you cannot get it. So your only option then is a Medicare Advantage plan. Okay, so I've gotten a lot of information and I know some of it may not pertain to you and whatever. So I really just want to open it up to any other questions so that I can make sure that I cover all the information you guys want. But individuals, information you want counseling, I'll be glad to do that over the phone too as well.
Do you have any suggestions for dental insurance or eye insurance?
Really on those, I do suggest you go to the dentist's office or your eye doctor and say, which are the policies you take, and go from there.
Okay.
Okay?
Yeah. Okay.
Sometimes those policies are worth having. Sometimes they're no more than a discount policy plan. So sometimes, you know, it may be cheaper just to say what it would cost if I pay cash
Right.
than file for insurance. But that's something you have to talk to the doctor directly to be able to do. Because some doctors say I get, you know, those discount, they only give you a discount, those insurance things, you're paying maybe $35, $40, $50, but you still have to pay 50%. Well, you could have gotten probably negotiated that 50% off directly with the person you're working with.
Paying them.
So
Yeah.
it really does depend on whether or not having those individual policies are good or bad. You have to really talk to that individual dentist or that eye doctor to see if they're willing to deal with you as a cash on. Now you can have those policies and still sometimes work on cash, and then you file with the dentist. I know that many people do that. That way they save even more money because they pay cash for the dentist and then turn around and file a claim with the dentist plan and get reimbursed that way. And sometimes you can save money that way.
Okay.
But it's a little bit more work on your part to do that.
Okay.
Okay?
Okay.
Melinda?
Oh,
I think they're going the route of they want to come sit down with you individually and really go over, you know, because everybody's situation is a
Bring my
little bit
husband
different.
along.
It
You
is
know?
very
Yeah.
different.
That's
Yeah.
me too. I want to sit down with you, Rachel.
Your card, that her
I'm gonna be
card.
glad, Dawn, especially with you being new to Medicare, you know, you've got a little bit more options and it based on where you at, are you getting retiree, things like that. And so, and also are you already retired? Are you
I
getting
am
Social
already retired. I have no retirement benefits or anything like that.
Okay, so you're pulling Social Security already, right?
Yes, yes.
So you're going to get a welcome to Medicare letter 3 months before you're 65.
Okay,
They're going to get your Medicare card and things like that. And they're going to give you information kind of like what I already gave you. And that is the best time to call me and talk to me is when
Okay.
you get that package. Then we can talk about the pathways which will fit your budget, okay?
yes, ma'am. That'll be great.
Okay.
Can I have your phone number or does Laura have it?
I'm gonna try, is that showing up?
I can barely
Kinda.
see it.
No, my number is 979
I can see on there.
Okay.
595
Okay,
2801,
801, okay,
and I'm an extension 2032.
2030,
It's backwards.
2032.
Oh. You read backwards?
I got it.
Oh, there you go. There you go.
I still
That's
can't
it.
see it because I'm blind, but you know.
Oh, you're blind. Okay.
I
Sorry.
have glasses and it's that tiny print I can't see. So, but I have your number, 979
Technology.
Still the same number.
2801.
Yes, extension 32. Or you can just say,
2032.
yeah, if the operator picks up, just say, I want to talk to Rachel about Medicare. There's lots of Rachels, but there's only one Rachel that talks about Medicare.
Great. Thank you for that.
Y'all have any other questions?
Yeah, it's got extension 2032. No.
Donna, any other questions, or you're gonna make a
No,
plan
no,
to visit with her?
I'm going to wait till I get my letter and I'll call her and visit with her.
There you go. Very good. Very
Yeah.
good. Well, thank you so much, Rachel. I apologize for the little break, but we'll have part 1 and part 2, and I'll work on getting it all combined into one MP4 file that we can upload.
Perfect. But one of the things that now that we're done with Donna too, that those that on Medicare, I want you guys to know that this is the time period to look at your plans, okay? To see, you have until December 7th. So, Susie, with your special needs plan, when she was showing on Medicare.gov, if you looked on the top, that said add special needs plan. You can click on that and it will show you the different chronic disease special needs plans. But don't get it confused with the ones that are called Medicaid, because you don't have Medicaid, okay?
Yeah. Okay.
So, but you're looking for the plans that have that C-SNP on there, okay?
Okay.
But to be honest, it's only United Healthcare who has these plans, and you're
Okay.
probably on the best one. Now, they have probably tweaked it. So go look at United Healthcare plan, their website. I do like their website, and look at the special needs plan to
Okay.
see what it looks like in 2021. There is some slight changes.
Okay.
Now,
Okay.
if you can kind of see that, I can help you step through that if you need to. Also, if you want to talk to an insurance agent, I do have a friend of mine who is an insurance agent for United Healthcare. She's the only one I will recommend, but you really don't need to talk to her, to be honest.
Okay.
It's all website. But you may want to stay in the gold. Okay.
Yeah. Well, I just wanted to ease my mind that I was on the right.
I would look to see the difference between the gold and the silver. Okay.
Oh, okay.
There is a silver plan for special needs. And I just remember one time going, silver looks better than gold. How is that? You know?
Oh, okay.
So look at that to see. But I'm really excited. You're not on insulin yet, are you?
Oh, no, I'm just on pills. Yeah. And metformin.
Okay. Because now they do have, if eventually, and it may happen, don't get frustrated if it does, eventually you may get on insulin, and it's just part of the aging process sometimes for people even on type 2. But anyways, they do now have a policy that insulin is now $35 a month.
Oh.
With your other friends who are maybe on insulin, they're paying thousands and thousands of dollars. That is the one few good things that the government did recently is enact this insulin slaving program, which are now $35. But I'm glad you're not having to do that yet.
Good. Yeah, I've been on metformin probably 10 years now. So
Yeah.
it's been a while. So, okay, good. I'm glad to know I probably made the right choice. So,
Yes, except I am concerned what you end up having to lose by switching from your retirement package.
yeah.
But,
Yeah. I'm still going to call I don't understand what that balance is in his account. I'm going to call and see what's going on with that.
It does make sense to have like a spending account for medical costs that are not covered.
That's what I'm sure that is for him. He's 6 years older than me. So, yeah, he probably needs it more than I do, but you know.
well, like I said, then I would look to see what qualifies for that, because you said he spent $500 for glasses. You may be able to get reimbursed for those glasses. A lot of times it has to be done within the year that you do it. So I don't want you to miss out on that reimbursement.
Right. Okay. Thank you so much. Yeah.
You're welcome. And oftentimes you can use over-the-counter medications, sometimes in these health savings accounts too, if that's what this is.
Uh-huh.
So a lot of times people will go and get, baby aspirin or acid reflux medications and stuff with
Oh,
that.
yeah. We both take over-the-counter stuff. Yeah. My doctor's recommended it and his has too. So.
Yeah.
Yeah.
It's probably not a true health savings account, because you can't have a health savings account and Medicare at the same time, but it may be something similar because it was a retiree.
Yeah. Okay. Yeah. I'll need to call them and talk to them and see. Okay. Great.
All right. Is it Belinda?
Melinda. With an M.
Is it B or M?
M.
M. Melinda. Okay. Melinda, so do you have any questions?
No,
wanna
I
just
think I'm
call
going
me?
to call you and set up a time, bring my husband, and we'll sit down and discuss it.
Okay. Definitely give me a call and set an appointment, because it's kind of nutty
Sure.
crazy.
Okay.
So,
Yeah.
yeah.
Because she turned 65 in February, so she'll be getting her letter here soon.
Yeah.
Oh, yeah. But are you going to get onto his, so the plan, you're currently on his TRS plan?
Yes, I'm currently on his plan. He was the teacher, and I was just on his plan all these years. So
All these years. Okay. So you're paying a large monthly premium to be on that plan.
yeah,
Yeah. So you may save some money by not being on that plan, but you'll
Yeah,
have
that's
to
what-
bring You
I'll
you
bring
need to
all this
bring me those
information.
plans. Yeah, because I don't have the current one anymore. We didn't do it. Normally the state does a training for us in Austin, but because of COVID, we couldn't do it. And one of the speakers that generally come is TRS, and they usually bring their new stuff. But because we didn't meet, I don't have their current and what their changes are. And the TRS system has known in this last few years to do some radical changes on you guys.
Oh, yeah.
I'm hoping it's not radical this year, but I know in the previous years.
Well, they're switching from Humana over to United Healthcare the first of the year. So I do know that that's a change.
Okay. Well, that's because, yeah, United Healthcare is trying to monopolize the Medicare Advantage plans.
Ah.
Yeah. And they're making a lot of money. And so, but like I said, I'm glad that they're leaving Humana, because Humana is one of the first Medicare Advantage plans, and they had those deductibles. And like I said, I hate those deductibles, because most of my clients, $750 or $950 deductible before they cover anything. A lot of my clients on even Social Security, even a large Social Security, that would be hard to manage.
Yes.
Mhm. Yeah.
So I'm glad that their TRS is leaving that, but I'm curious to see what their United Healthcare plan looks like.
Okay.
So yes, but bring that and we can sit down and we'll do a cost comparison for you.
All right.
Okay.
Thank you.
Thank you,
You're
Rachel.
welcome.
We appreciate it so much.
Thank you, Rachel.
Yes.
You're welcome.
I can tell
Bye.
they have lots of good information, and they at least know they can come to you with specifics and individual stuff. So we appreciate that.
Yes,
Yeah, thank you so much for taking time.
Yes.
you're welcome.
And I'll share the video with you when I get done.
I'll come that way, okay?
I know. Yeah, we look forward to having you in person.
Yes. Yeah.
All right, thank you, everyone.
you.
Thank
Thank
you. Bye.